have for us today?
Lori, I think it's Public Safety Day, right? We'll start it out.
That's right. We'll be starting on page 234 of your binders, and Rusty Leeds will be kicking off the presentation. And just a note that I will send out the PowerPoints and link to you all after this.
Okay, thank you.
Good afternoon, Chairman, Commissioners. I'll be very brief. Today is Public Safety Division Day. The missions of the Public Safety Division is to ensure community safety through a system of partnerships, prevention, protection, prosecution, and incarceration. The departments listed below there provide those services on various levels to various populations, and they'll be presenting in the order that's listed there. And then the PowerPoint is put together in that same order, so you should be able to follow along as we go. It is printed two to a page, front and back, color. Alora's budget graciously provided these printouts this afternoon. So with that, the strategic plan that we developed back in 2019, started to get into in 2020 before the pandemic, sets forth goals for public safety in general, which includes the sheriff and the public safety division, these departments here. Some of these things have been worked on even through the pandemic. Some of them we need to get more in tune to as we transition out of in the recovery phase of the pandemic and get back to work. These folks are very busy with the things they're doing and with the resources they have available to get the job done. So I won't delay on that. And we will start with Dr. Stedman in the Regional Forensic Science Center. In the past, I've stood here and done all of these, but today the department directors will be before you to present their own budgets. So with
Thank
that,
you, Rusty.
Dr. Stedman.
Good afternoon, Dr. Stedman.
Good afternoon. So the Regional Forensic Science Center is where we do medical legal death investigations and carry out autopsies for the certification of cause and manner of death. And in our crime labs, we conduct analytical testing to support the resolution of criminal cases. And together, we collaborate with our stakeholders to reduce crime and prevent deaths. And that's the short version of our mission. This is our organizational chart, and we have 5 main operational sections. Under the forensic laboratory section, there are 5 specific disciplines, each of which have supervisors who report directly to me. I'm going to present decision packages which will mainly benefit the pathology and autopsy shortage in staff, and also the increasing in the number of deaths that have been reported in scenes attended by our medical investigators. Just to point out the critical nature of our staffing in pathology, each pathologist is supposed to do 250 to 325 autopsies per year. We're currently doing 1,200 autopsies with 2 pathologists. So we're struggling to meet not only our accreditation requirements, but also timely service to the public. And the first decision package will address that problem. And you'll see a little addition beneath the forensic laboratories. While it looks like we're moderately staffed, 5 of those positions are actually individuals in training. And it continues to be a problem with us. We spend and invest time and resources for 2 years to train somebody. They qualify for court, and then they move on. And so when you see 50% of your staff leave every 2 years, it begins to get a little disheartening to those of us who stay. And it's been a particular problem in the toxicology laboratory. A lot of that has to do with the fact that our postmortem toxicology laboratory is the only of its kind in the state of Kansas. We also do quantitative testing on drivers that other labs at the state level do not perform. So when somebody finishes the training in our toxicology lab, they're very marketable. So I think attrition is a good springboard into the Regional Forensic Science Center strategic plan, which was developed in 2016 with 5 strategic goals, the first of which is employee retention. This is the very thing that Human Resources has been addressing, and we're hoping for your continued support on as we evaluate our compensation throughout the county. I would also like to point out, and I will continue to advocate for those employees who are maximized within their pay grade. I would hope that they can receive true cost of living increases, and so that becomes part of their base salary for the upcoming year, because I do have a couple of employees who are in that position and have been on essentially a fixed income for a number of years. Our second strategic goal is an expansion of physical space, and in 2014, we developed and proposed an addition to the existing footprint of our building that would address our needs for the foreseeable 10 to 20 years. In 2018, we had a second design, and that project is still on the watch list. As I stand before you today, we are about halfway through the period of time that this project was supposed to address the needs, and so I hope to be invited back for the CIP portion of the budget process, which will be later. Our third strategic goal was a laboratory information management system. We've been successful in the grant funding for that. It went online at the end of last year. If I thought the grant funding was going to be difficult, the implementation has been very difficult, so it's ongoing, and we're putting more of it into the works as time allows. And our fourth strategic goal is for an equipment replacement program. Just like in a city where you need to replace a certain number of mowers and squad cars every year, we need to replace instrumentation every year, and we're not currently able to do that. So we use grant funding where we can, but unfortunately, the amount of grant awards that's currently available doesn't pay for the instrumentation that we require. So because of that, a lot of our instrumentation has previously been bought used with very short lifespan, and in 2024, we're going to be in a critical situation where several key instruments are going to have to come offline. The final of our strategic goals was training and continuity of services. And under this section of the strategic plan, we took a look at every forensic discipline, kind of looked at how that science was evolving and what we would need to address the future needs. And so from that, when I was asked about ARPA funding requests, I took two things out of this strategic plan, and I requested, one of which is actually in the budget request today, and I'll explain to you why, and the other was that critical toxicology instrumentation that's going to need to be replaced in the next 2 years. Challenges. As you all know, we've had a lot of challenges recruiting certain positions. Chief toxicologist has been one. We will have somebody January 1st, 2023. That'll be 2 years after we lost our full-time chief. You recently approved a contract for a pathologist that will begin in July 1st, 2023. So that will also be vacant by the time she arrives. Our pathology and investigation workload is increasing. Quite frankly, the number of deaths in Sedgwick County is increasing. I've already talked about the instrumentation. We all know the cost of business is going up. And we have begun to address, and the leadership team was supportive of my request for some additional funding to accommodate the increased need to deal with unclaimed bodies. We are statutorily required to give them their final disposition, and last year that went up nearly 30%. Part of that solution included installation of a new body cooler, which we funded with CARES money. And while that was great to deal with our indigent population, it displaced all of our morgue storage. And so while we fixed one problem, we sort of created ourselves a new one. And so this is a breakdown of our budget requests. And I think the Regional Forensic Science Center revised always looks very different than what we requested, quite frankly, because the amount of grant funding that we receive, and this last year there was a great deal of instrumentation or equipment, and there was some grant money for training our firearms examiners that was contractuals. I've moved some of the support agreements to grant funding as well. So I just want to take out one moment before I present my decision packages to talk a little bit about the ARPA funding. Because one request here does overlap an ARPA request, and there's another one that I feel is very important. I looked at how the spending plan was laid out, and a lot of the needs go to the courts, which is no doubt a huge need. But when the vast majority of criminal cases involve our facility, it's not really reasonable to dismiss the fact that when you expedite a court case, and that evidence is sitting in the Regional Forensic Science Center's backlog, that's going to have an impact on us, and that's not going to be a positive impact. I also noticed that going forward, there's been a lot of emphasis on fighting drug abuse, preventing suicide, and addressing gun violence. And I want you to know that most suicides, the vast majority of suicides involve a firearm. The vast majority of homicides involve a gunshot wound. And every last one of those violent death victims comes through our morgue. When you ask how many suicides there are per year, and if the suicide rate goes up, we're the ones who have that data. When you need to know how many fentanyl overdoses there were, we have that data. When you want to know how many people died of gun violence, we have that data. And I guess my point is, in the grand scheme of things, I don't fall under the DA's office or the sheriff's office when those things are asked for, and our department is small, so I want to be sure we're not overlooked. Because I know you know what we do, and but I have been called to the carpet even to explain why a firearms examiner plays an important role in fighting gun violence. And so I know that the general public does not necessarily understand the broad-reaching impact of our work. Okay, here's a quick overview of our decision packages. The first involves the physician contract that you have approved for our third physician to start July 1st of 2023. We were very deliberate in that salary negotiation and researched posts for job positions in the area and across the United States. And in order to be competitive and to negotiate this agreement, we will need to adjust the salaries of our existing physicians, because we cannot pay the new person who's coming straight out of school more than we are paying our physicians who currently have 10 or more years of experience and different sets of qualifications. So this lies a little bit outside of the work that's being done by HR, because these are all contract employees. So that request is $99,739. The second decision package is for 2 full-time medical investigators. So the number of calls we're getting, most deaths are reported to our office. That's increased 23%. Some deaths require we go to a scene. If you are a victim of a car wreck and you are transported to the hospital and you die at the hospital, the body will come to our center without a scene investigation. But if you are pronounced dead on the scene, a medical investigator will come to the scene, take custody of the body, and have it transported to our facility. So all of that workload has increased. We have 5 medical investigators that work 24-hour shifts to provide 24/7 service. So when we have somebody who needs medical leave, we have somebody this fall who will be taking maternity leave. This is very difficult, and it was very difficult through COVID. When we had people who had a sick child for 2 weeks and then had to quarantine for 2 more weeks, it was difficult to provide coverage. So that said, if you have 5 people who are providing 100% of the service and you've got 40% more work to do, the math tells me we need 2 more people. I also would like to improve the continuity of service we provide, because if somebody goes to a family, hands them their business card and says, if you have any questions, call me tomorrow, or call me, and they're off for the next 2 days. Meanwhile, the autopsy takes place and the body is released. It's not the best continuity of service that we could provide to the public. And the last decision package is for a Lodox high-resolution X-ray imaging system. This is basically a system that scans the entire body while it's still in the body bag from top to bottom and gives you a full image of the person in 30 to 60 seconds. It currently takes us about 10 minutes to capture an image that's 11 by 17 square with our X-ray technology. So recognizing the importance of this for cases involving gun violence, because X-rays is how you determine where a projectile is after somebody is shot, and that this would completely revolutionize the way we do business, I put in an Arpa request for this. Then 1 week before decision packages were due, our X-ray machine broke, and we called out for service, and the person who came was able to fix it, but told us that if we require parts in the future, we're probably going to be dead in the water. So having the window to put this in as a decision package, I did so, not knowing where we stand with our contingency fund, and that's why you're seeing it today. That said, I recognize this is a lot of money in the budget, and would like to continue to focus on compensating our employees. And in recognizing that, I did try to get that service person out to talk to us what we could do to keep our existing system in operation. And he evaluated that the generator, the table, and the tube, basically, the main static parts of that are fine, but the digital imaging system needs to be upgraded, and the cost for that, also, we have a computer that I think is Windows 7. It's a little time bomb, probably, is $25,000. So while my job is to advocate for my staff, it's not my job to exaggerate for my staff. And so bottom line, we need $25,000 to stay in business. And x-rays are something we absolutely need. So, if ARPA can accommodate a purchase that's 10 times that, yeah, the Lodox would be a game changer, absolutely. So I wanted you to understand why that has changed and why it was important in terms of the ARPA funding and why it is eligible for that. So finally, we do have one revenue package. Last year, we revised our fee sheet that we charge out-of-county agencies for our autopsy and toxicology services. And we raised those fees by about 15%. And in doing so, I think it was a cut and paste error. 4 of the tox assays that are generally used for screening on postmortem cases they were inadvertently omitted. So we'd like to fix that. We are going to charge for them this year under miscellaneous charges, but it just is a formality to get that fee sheet corrected as we move into 2023. And this is our final overview for the amended physician contracts, the full-time medical investigators, and this actually includes the Lodox. If the $25,000 alternative were to be accepted, the bottom line would be $275,292. And we believe that the revenue package will be completely neutral. And with that, I can answer any questions.
Thank you. Commissioner Cruz?
Thank you, Chairman. Thank you for being here today. You made some really excellent points on the key role that your department plays in the whole system. So please know that your points were not lost on me. I do have some questions, and I'm not real sure to ask this because this is like a really fun topic to talk about and all. So that was a joke. Hope somebody understood that I'm not. I'm uncomfortable asking about this. The number of deaths. What is the number of deaths? How are you categorizing it as normal deaths in a year compared to? I hope that you understand my question because it makes me super uncomfortable to even ask you about that.
I think what you're asking is, of the reported deaths, how many of those turn out to be coroner cases?
So you said that they keep increasing. The number of deaths keep increasing. And so I guess what is the cause of the increase? Is there anything to surmise from the information around what is causing the increase? Is it gun violence? Is it overdoses? I mean, that's really what I'm kind of after.
I don't think I can answer that question. I mean, when we look at the cause and manner of death over a period of time, it's not like we're seeing a great change in ratio of what's happening. We do know the suicide rate didn't go up. We do know that the overdoses have increased, and you've been provided last staff meeting that information. Mm-hmm. And certainly the ones involving fentanyl have increased. So I think those are factors.
Okay. Thank you for that info. I just wondered if there was some sort of information we could glean. The next question I have would be, when will we be considering the contingency fund? And I guess that's obviously what we're doing now, but that will be a discussion at the end, or that will be in the recommended budget, or that will be when we all go up to the 8th floor and discuss this?
So, Commissioner, right now what we're planning to do is to have any department that submitted an ARPA request that wasn't funded, if it is a decision package that they have put forward, they're going to bring it up to you during the budget hearings.
Okay.
And so what we will do in your discussion portion, or even over the next few weeks, because you do still have some budget workshops to hear about some other needs outside of just what you're going to hear through here. So we'll get through all of that. And then I think, yes, we will package something as a part of a recommendation, whether that's through the budget or through proposed use of that $9.6 million contingency that we have sitting there today.
Do we know what is actually needed in that fund? Do we have a number, like what is available?
So I think when we had last talked about this, what our consultants have advised is that we ought to keep approximately 10% in the early years. So we're in 2022, we still have to make it through 23 and 24 with our ARPA allocation. And so that's why they had said 10%. But then as we go further into the year or further into the award, then we can start to draw down that contingency to make sure that we're not missing out on opportunities to use that funding in a way that you all want. So probably what we will want to do is get some updated estimates on the COVID-19 issues, on anything related to the rough and move, because obviously these estimates were put together before we had 8.5% inflation. And so we'll get all of that incorporated into kind of one big update and then use that to talk with you about what should be funded. Does that help?
Yeah.
Okay.
Yeah. Thank you, Lindsay. Thank you, Dr. Stedman, for being here today. I fumbled around those questions because you do some really difficult stuff. Vitally important to many people as far as needing the information around the death of a loved one, court cases where people, their lives are affected by this information. So, forgive me for being so, it just kind of got to me a little bit when we're talking about this. Those are all my questions. Thank you.
Thank you. Commissioner Howell?
Thank you, Mr. Chairman. So, a couple of questions. The enhancement for salary for the two forensic pathologists, that's about $100,000. So it's about $50,000 increase for each of the two people that are there.
There's actually about $10,000 for the moving expenses of the new pathologist, which will then be used in the next year to accommodate the expected increase after she accomplishes her forensic boards. And so that leaves a little over 40 for each of them.
What kind of a percent increase is that for those two folks?
It's not very much percent increase if you look at the critical pay they're currently receiving to cover this work. I don't have that right off the top of my head, but I can give you two numbers.
Okay.
One of the current salaries is $217,262 and would increase to $260,000.
Okay.
Pardon? 19.7%.
Okay. I'm just, and again, that one is not, that's not ARPA funds. Is that what you said? That's just, okay. That's ongoing.
That will be ongoing. Yeah, I tried to be smart in my ARPA request to be equipment purchases. Yes, LCMS instrumentation has service contracts, but if we could replace two that are 20 years old with new ones, those service contracts would be much cheaper. So I'm not worried about that. But yeah, our requests don't involve people as far as ARPA goes.
And those two employees have been here for a long time, I assume?
Yes, sir.
Okay. Do you guys normally support things like lateral, I know in the other public safety sector divisions, lateral transfers at Sedgwick County have been pretty much not allowed. Do you guys recognize tenure and experience other places when you bring in someone and you place them into, could they be brought in and be over someone else, for example?
Yes.
I'm just wondering if this person coming in, I don't know what their experience level is, but it seems.
Their experience level is they're completing their residency and will complete their fellowship. And they will, that fellowship offers them some opportunity to conduct autopsies. And then they will start doing autopsies for us immediately.
So basically entry level.
Correct.
Sedgwick County, okay. And then likewise, the medical investigators, we have 5. And you said one of them's going to go on maternity leave and another one was gone for some reason, but we're going to add 2 more. So we're going to go from 5 to 7?
Yes.
I understand. That's the request. I'm curious whether or not we've ever thought about doing like a pay for performance. In other words, have these folks on call and not be full-time employees with Sedgwick County, but basically pay them for each caseload that they take. If they take a case, we would pay them for their time on that case, probably pretty, fairly good money for the hours that they're putting in, but rather than make them a 24-hour shift, that 24-hour shift, how often do they get called out? on a 24-hour shift?
They might receive about a dozen calls to triage, and then they can be called out to 0 scenes or they can be called to 10. It just depends on the day, but we have tried a part-time solution, and we found that it was very difficult to find somebody to do this work. Also, when a case, it doesn't end when you pick up the body. There's identifying the body. There's requesting the records from the hospital. There's providing any questions that the pathologist needs as they progress through trying to determine why the person died. So the patchwork hasn't been extremely successful, and I think, again, goes back to contributing to our inability to provide a continuity of service where people are leaving notes for the next person who comes on shift. And we did try that, and it's a challenging position to fill, and it's even more challenging to fill part-time.
Yeah. And I actually wouldn't even term it part-time. I say that the idea would be that you'd pay for each case that they take a call and they go out and do their job, and they would file the appropriate paperwork, and then they would be paid for that response in that case. So, you could have, they might have other jobs for all we know. I don't know what else they would be doing, but it seems like they ought to be paid for the work that they're doing. But since there's times where you probably don't have any actual cases coming in, they may be on call. They may be on, standing by waiting for a call, but not actually be doing anything because the help call hasn't come in. So it just seems like I wonder if we've ever thought about doing a pay for each case they take. Go ahead.
They did operate as on-call service previously. I can provide to you I can't today, but I can ask and help you understand why we switched to this service. I will tell you the volume of violent crime in Sedgwick County, as the state goes, is a lot higher. And the service our medical investigators provides outstanding.
Is any of this service billable to anybody, like insurance or is there any of this work actually billable to anything at all, or is it all just covered by taxpayer dollars?
It's covered by taxpayer dollars because it's part of our responsibility to carry out a medical legal death investigation on which medical investigator is the forefront. And it is when our investigators work on an out-of-county case, like they would request medical records, they do bill for that. So we do have revenue for medical investigations.
Okay. That's all my questions. Thank you, Chairman.
Thank you. Commissioner Meitzner.
Thank you, Mr. Chairman. Doctor, thanks for being here. And so noted, I'm reminded yes, we have put a lot of effort behind the courts and the sheriff's office and a few other areas, but it's a reminder that the unintended impact of what you do to help support the sheriff and the courts is so noted. I appreciate you bringing that up, so thank you.
Thank you.
Thank you. I don't see any other questions. Thank you, Dr. Stedman. I
Thank you.
appreciate it. Good afternoon, Laura.
Good afternoon. I'm Laura Forsey, Director of Emergency Communications. So getting into, just dive right into our department and what's going on currently. We are 106 people, 106 FTEs in our department. Right now we're sitting at about 70% staffing overall. Our biggest areas of deficiency are in operations. You can see there that we have about 62 of our positions filled of the 92. And as you dive deeper into that, it's really at the call taker and dispatcher level, which is that front line of support where we are hurting the most. We are staffed currently at 65% there with 54 of the 83 positions filled. Getting into our strategic plan, we've got several goals here. The first one is access to services. And that's just providing the community with that consistently efficient, effective, and equitable access to emergency services. This includes our goals to answer 90% of calls within 15 seconds, and that's a goal that we are not currently able to attain. Our second strategic goal is the response to community needs. We want to be proactive and reactive to community needs both, and that includes making sure our staff is well trained and ready to respond to whatever the community needs. Those community needs are changing. We're seeing that over the last couple of years with mental health calls, with the overdoses, things like that, that we need to be really responsive and able to serve the community on. Our number 3 goal is staff retention. The goal is to improve staff retention by supporting employee professional development, identifying and addressing mental health needs of staff, and providing staff with adequate time away from work. This is one, of course, that we're really struggling with at our current staffing levels, and making sure people have time to come out of that saturation of tasks that they're sitting in, that vicarious trauma that they're sitting in, and coming out and diffusing and getting that appropriate and adequate rest. It's a real struggle right now for us. Our 4th strategic goal is innovation. It's to provide innovative solutions for public safety that's responsive to emerging technology and then the changing needs of community. Looking at our challenges and opportunities over the next 5 years, we just are at a very critical point in staffing. We are back to a pre-2021 level of resignations, and so we're in a field where it's not going to be for everybody. You know, it's a 24/7 job. We're not off Saturdays and Sundays. You're sitting there, like I said, steeped in vicarious trauma, and it's just not going to be the field for everybody. So we're always going to have a certain resignation rate, and we are back to what we were pre-2021, but 2021 was a hit to us, and we've not been able to recover those numbers. We are competing with call centers that have a 23% higher wage starting out. We've got another call center going in out at Town West. MCI is going in out there starting at $20 an hour. We've got T-Mobile advertising a starting pay of $20 an hour. So when we say come in at $15.40 an hour and listen to people that are getting shot at on the phone, and you're going to work nights and weekends and you won't get off at 8 o'clock like you will at T-Mobile, it's a really hard sell for people. Community expectations for 911 staff is growing, specifically in relation to mental health and services that 911 should be able to deploy. Part of that is outside of the 911 system. We have to have more resources to deploy. We can only send what we have, which is police, fire, and EMS now, and ICT one part of the time. But we're getting growing requests for other things to be able to send, other responses to be sent to crisis other than the police, fire, EMS model that's decades old now. And then technology continues to evolve, which takes time and staff, both to evaluate it, implement it, oversee it, train it. These are all things that those of us that are up in the administrative level are wearing many hats and trying to help cover in operations, trying to help cover new technology, covering everywhere that we can, and the coverage only goes so far. A lot of challenges. Our budget is pretty much the same from 2022 to 2023. It's just slightly down. And we have just one decision package, and that's for a 911 training facilitator. We have one training facilitator currently. That person is very busy training all of our new hires and then our promotions into dispatcher, which is a new skill set. So because we've had this continuous hiring that we have going on and continuous training, our continuing education, which is beyond those new skill sets, has been really lackluster over the past 2 years. I believe that is a direct relation or has a direct feed into our retention rates. People want to feel like they're comfortable and capable to handle whatever comes their way when they answer that call. And so when they feel like they don't have that training, they're not prepared for that. And who wants to sit there and handle an emergency that they're not prepared to handle? Beyond that, we do have a community request for us to provide different training, especially as it relates to mental health calls. So we have to have somebody that can bring that training together and make sure that that can happen. This is just for one position, and it's $75,000, as you can see, in some change. So not a big dollar amount, but I know you have a lot of competing interests. So that's it. Pretty short and sweet this time. Any questions?
I've got one question on the decision package. You've got a lot of openings right now. You got a bunch of red here. How are we wouldn't it be important to fill those positions first and then fill this training facilitator?
We are continuing to fill those positions, running training classes as quickly as we can, as often as we can. In the meantime, though, I feel like I have an obligation to my staff and to the community to ensure that the staff that we have are adequately trained and that training does not stop when they leave the academy. So, yes, you are correct that we have those positions that need to be filled. This would be an internal promotion, but I think that weighing out the benefit of the cost, I think that this is worth it.
Okay, but just adding another position on your books where we don't have people to fill the open positions now, does that really benefit anything?
Well, again, I think that having our staff trained and able to respond to the needs of the community is beneficial. So while I would lose one person out of operations to go into that training position, I think that the benefit of having that person available to train would speak to why we would do it.
Okay. Commissioner Howell?
Thank you, Chairman. I haven't done the math yet, but I'm seeing on the page 189, the training facilitator that you have right now is at 40, well, the recommended budget is 46,862, and your request is for 75,276. Is that because of benefits and all the other things? Okay, so that's my only question. Thank you.
Thank you. Commissioner Lopez?
Thank you. I just have a question on the personnel cost between 22 and 23, and most of the other ones that we've looked at, they've all decreased. Yours is increased by 1%. I'm just curious what that is from.
Can you speak to that? Thank you.
So in 911, they have what we call tiered staffing in their positions. So we add in budget authority. So if somebody promotes during the year, they have the budget authority to promote them.
Okay, just curious. Thank you.
Hey, I don't see any other questions, Laura. I appreciate it.
All right, thank you. I appreciate the consideration.
Welcome, Kevin.
Good afternoon. Kevin Letterman, the Interim Director of EMS. We'll get right into ours. Ours is going to be pretty short also. Our org chart, if you look at it, might be better on the screen because I'm sure the handout you have is probably not legible. We kind of dug a little deeper so you could see where the exact openings are throughout the organization. Our 261 FTEs, 233 of those which are in operations. Those are where we're short at in those areas that are red. Obviously, the paramedic level, street providers. We're still 16 positions short at this time, paramedics. I'll talk to you a little bit about how we're trying to improve that staffing. So that's currently where we are as of today on our staffing. Our mission at Sedgwick County EMS is we are committed to providing quality out-of-hospital health care. We do that. We are the exclusive provider of emergency medical response for all cities and rural areas of the county. All of our ambulances are ALS equipped. We have ALS support personnel and equipment on board. Additionally, we also do the scheduled ambulance transports that are with medical necessity throughout the county. And we also provide advanced life support, first response to the rural areas of the county. Our department is funded through a combination of user fees and the tax subsidies. Our strategic plan, our goal number one is to ensure that we have the resources available to efficiently and effectively meet the immediate healthcare demands of the community. Strategic goal number two is to promote a culture that prepares and empowers the workforce to provide quality care and ensure customer satisfaction. Do that through education, leadership. Strategic goal number three is to provide compassionate, patient-centered care to positively impact the health and well-being of the community. I think that goes right along with our mission. And then strategic goal number four is that our goal is to respond to all emergency calls in less than 11 minutes, 90% of the time. Some of the challenges and opportunities we'll have in the next few years, as most of the other departments have already talked about the recruiting and retention of qualified personnel. That'll continue to be at the forefront of our department's priorities until we're can meet our production targets for the current demand levels. We expect that improving that staffing will help decrease burnout, hopefully lead to better retention, and also reduce response times. We plan to accomplish this increased staffing through a combination of things. Our recruiting efforts, competitive pay, which the county's working on now, and through our EMT to paramedic program that was passed last year that we currently have 9 paramedics in EMTs in paramedic program. We also want to increase the capabilities to align with our industry standards to providing critical care scope. We want to increase that coverage throughout the county. And we want to develop alternative response models such as telehealth, mobile integrated health to align services when we get to the point where we're providing our core function of pre-hospital health care. Then those are some of the other avenues that we'd like to branch out to. And expand employee education programs. That's the lay citizen to EMT programs that we hope to start here soon. So here's our 2023 budget. I know there's some increases on there that Lindsay or somebody can probably explain better than I can on the contractuals and the interfund transfers from us going to our special fund to the general fund. So since we're the first department to go through this, I don't know if you want to explain that now or.
We're fighting about who gets the pleasure to tell this to you. So if you remember back on last Wednesday when we were talking about the unique issues on that long sheet, and one of the things we talked about was the fund balance issue. So what this reflects is the move of the fund balance, the cash, that was sitting in the EMS fund into the general fund. Because it's a certified fund, we can't just do what we want. We did not know at the time that the 2022 budget was adopted how much would be remaining in those funds. So now that we know, we're going to be doing these transfers from EMS, from noxious weeds, and from ComCare tax into the general fund. Those dollars will be restricted. They may only be used for the purposes for which they were charged or collected. So EMS funds will be used for EMS. So that's what it accounts for the interfund transfers. The increase in contractuals is basically the administrative charge that fund would have paid this year for services incurred last year. But again, there was no budget for that. And so this will make that whole, and then it will be done forevermore. So hopefully that answers that question adequately, but happy to field any others.
Commissioner Cruz.
Thank you, Lindsay. So in reference to this long sheet, is that under the ending fund balance, line 48? And if so, it doesn't match that.
So what you will see, if I can find my long sheet, and I did not bring my glasses. So if you, look on row 45, that has the aggregate balance for all 3 of those funds. So that would be EMS, ComCare, and noxious weeds. Those 3 will combine together to go into the general fund. And so there will be a mixture of administrative charge, which is shown in the contractual line here on this slide, plus the interfund transfer amount that's on this slide. That's actually the cash that is earmarked for EMS use only once it gets into the general fund, or ComCare tax, or noxious weeds, depending on where it comes from.
Thank you.
Kevin, I've got a couple questions, and I appreciate this opportunity to kind of get an update on where we're at. First one is Clearwater and Cheney. Are we pretty well able to staff those every day, or where are we at?
We're still staffing them. I think the last week it was about 70-75% of the time. is where we're staffing.
Okay, do you got a projection in the future with the different programs we've got in place to try and increase the number of paramedics when we'll be up to 100% on that?
I do not have an exact projection. I know I had the opportunity to go down to Clearwater and visit with them about their first response down there. And like I told them, I wish it was going to be an immediate thing for our staffing to get to where it needs to be. I said we're waiting for EMTs that are in paramedic class now. We're actively recruiting, but in all reality, it may be a two-year or so process before we get fully staffed to where we want to be. And our goal at that time is not only to have 100% coverage in those areas, but if we get to where we're staffed, to increase other programs. And so like I said, I'd like to have a definite answer on that, but as staffing improves, that will also improve.
Yeah, a couple months ago when you and I had a discussion in the other conference room about going to other schools outside of the state of Kansas and see if we can recruit there. How has that paid out?
We haven't gotten any outside. I know we have tried to reach out to our workforce coordinator has reached out to some of those. We have actually reached out to some of the classes that had started before the EMT to paramedic program started. So they weren't eligible for that EMT to paramedic, but gone out and we're trying to recruit those unaffiliated students also. So there is a pipeline for that. We have a few in each class that we may be able to get. Like I said, it's tough because everybody's looking for paramedics, not just us. So we're all fighting for a limited pool of paramedics.
Okay. One thing that I started working when I first became a commissioner was a 5-year contract with the city of Wichita, and that should be coming up because I've been here for about 5 years. So where are we at in the process of renewing that contract with the city of Wichita?
That will be up at the end of 2023, I believe, is when that is up for renewal.
It's up at the end of 2022, and there is an automatic renewal unless either party wants to break it. So it's not that we have to overtly do something. If we do nothing, it just renews. So Papoon's been in contact with Jennifer. I don't think there's any, unless the commission decides from this side, I don't think there's any will from either side right now to interrupt that contract.
Okay. I know we were getting little updates on the ability for us to match what the requirements were, and I don't recall receiving any updates recently on where we're at on meeting the requirements of that contract. Are we not receiving those anymore?
I know Paul sends them I see him send them to Layton. I don't know that he sends them to commission.
We'll make sure you get those. I know he sends those out where we're at on those numbers on the contract with the city. But we are meeting those contractual obligations with those transfers for the city. So if you're not getting those, I will make sure you get those.
Good. And what's the impact on us monetarily on Wesley?
It's still too early. We still are doing some Wesley transfers. They're not doing 100% of those. It's been a couple months now. And the ones that we have provided, we have not gotten any billing or anything, any funds paid. So we're not sure how that's gonna affect our budget going forward.
So we are transporting for Wesley, but they haven't paid us for any of that?
That hasn't gone through the whole billing process yet from us to them and then paying the bill. So we have not received any funds for that. It's not that they're not paying it, it just hasn't gone through the process.
Okay. We have no contract with Wesley at this point in time.
That's correct.
So we are billing them at the full price.
As of March 11th, they got a letter that they would be billed at the full published price. That's correct.
We'll continue to bill at the full cost because we have no contract, and that's their choice, not ours.
That is correct.
Thank you. Commissioner Howell.
Thank you, Chairman. You asked some of my questions, so shorten this up a little bit. I am curious, Are we going to, or have we, or are we planning to attempt to renegotiate anything with Wesley at this point? I mean, is that just off the table entirely?
I don't believe Wesley at this time is interested in renegotiating anything at this time.
Let me answer. The manager and I had a discussion with Wesley, and I asked, is there any chance of negotiation at this time? And they said, no chance at all.
Okay. Well, I think we ended up in a place that's not good for Sedgwick County, and I think it's because of maybe a bad deal that was negotiated without really our knowledge. That I wasn't aware of it until it was too late. But so I'm not thrilled about that. Just a note here, last year he had about almost 20 FTEs worth of overtime expended, which is very noteworthy. I'm afraid the folks are getting burned out. That's a pretty big number.
And that's why I said our recruitment and retention is important, because that is a something that we'd like to decrease, because it does lead to burnout, and I'm sure that's led to probably some people looking elsewhere besides pay. If they can get something equal pay somewhere else where they're not working so much, then I'm sure that's attractive.
Thankfully, it's down from 2020, but it's still not great. Just to note, it's about 20 FTEs worth of overtime. That's a big number. A couple of other questions. You talk about 11 minutes, 90% of the time. We used to have like a 3-tiered target on that, inner city versus urban, urban, rural, suburban numbers. And this 11 minutes, is that supposed to be countywide? I think it seems like 11 minutes to the corners of the county would be almost impossible.
And that's just a target we set, like I've said before. There is no real national standard published anywhere that says that an ambulance needs to be here at this time. But that's the goal that we're setting forth.
Years ago, when we didn't have these staffing challenges, I believe we had 7 minutes and 59 seconds inner city. And I believe the suburban was, I think, 9 minutes and 59 seconds, and the urban was, I think, 11 minutes, 59 seconds.
Yeah,
something like
12
that.
minutes. Yeah, about 12 minutes. Yeah.
So again, our numbers have, so inner city, which is again, majority of the calls are inner city or suburban, we're actually seeing a reduction in our goal time, which may be lengthening of our goal time, which may be a consequence of being understaffed. But to me, that's not a great stat. I'd like to see it. I think the old numbers were better, and if we get back to that at some point, that'd be a good goal to have. These CRVs, even though they are manned, they're not hanging out in Clearwater, are they? They're being brought into. They're being staged, so to speak.
We attempt to leave them in those cities as much as possible, but when we run to status events where we have 0 ambulances in the city, we do bring them in towards the core where the highest probability of the next call is. But we're trying to leave them into the areas that their response areas as much as possible.
I know one of your guys, Saucy, probably keeps track of this, but it'd be nice to know how much time these are actually, kind of in their station versus being staged closer in, because I think shortages, again, probably are bringing them in most of the time. I've heard people from those Goddard and from Clearwater saying basically they're not there. In their opinion, they're never there. So that's what I'm hearing.
And that is a hard statistic to come by, because it's not tracked when we go fill. Even our ambulances, how much workload they have when they're going filling inter post, things like that. That's hard to track because it's not a call or any way you can really look it up unless you just go through every unit, their data for that day. So,
well, if we had all of our staff challenges fixed, maybe I would be more supportive of this. But right now, the CRV thing, I think, is hurting the rest of our system. And I think that the system we had before that we replaced actually was pretty good. So to me, this change has not been positive for us or for Clearwater or Goddard. And so I don't know that I'm happy with where we are currently. I would be open to the idea of maybe reversing those decisions, but I don't know that I'm happy with what we're doing currently, and I'm not sure when we're going to get this in a place where we can be happy about it. But I'm not personally very happy about it. But are you able to stage your equipment as you need to today? I mean, for a while there, I know there was some discussion about whether dispatch was doing that or whether you guys were doing that.
Yes, our shift commanders are doing the deployment.
Very good. I think we did have some access a couple months ago to some of the, the status level that was happening throughout the day. We saw some reports, but again, it's been very sporadic. I haven't seen those lately.
I can get you those report. All that information should be on our dashboard.
Okay, so it's
Public
widely
facing
available
dashboard.
now, so you
Yes.
can go find it.
Response times are on there. You can zoom in. You can get data from each city in the county as well as the whole county as far as response times. There's clinical information on there also, billing information on there. So
You said you were 16 paramedics down. Are you counting the 9 individuals in school as part of the 16, or are they in addition to the
No,
16?
those-
How do you count that?
they will decrease that number when they are finished with class. They're actually recruit paramedics at this time, is what they're classified as.
But we're still not counting them, so we still have a shortage of 16. If you
That's
counted them,
correct.
It'd be down.
Yes, we'd be down. Hopefully, like I said, when they get out, and there's always going to be that normal attrition, but hopefully when they get out, that will help increase or decrease that number,
Down to about 7,
hopefully.
if they all stay on. Okay.
And we don't lose anybody
You
else in the
mentioned, you
meantime.
went you said one thing, I didn't quite catch what you said, but you said there was a secondary program. You said expand employee education programs. You said something to EMT. What did you say again exactly?
We are hoping to start a layperson to EMT program. So if people that have barriers to getting into this profession, we can decrease those barriers and have them start and go through an EMT program, and actually, when they're done with that EMT program, be ready to be on an ambulance.
I'm not against the discussion, but I guess my biggest concern has been EMTs to paramedics. I don't know that I'm concerned about.
Now, we're going to continue that and hopefully increase that also. This is in addition to that. That's not going to take place of that.
Okay, but we've not had a shortage of EMTs. We just had a shortage of paramedics. Right?
That's correct. I mean, we are a few EMTs short right now. We do have some that are going through an academy right now that'll fill those positions. But no, getting the paramedics is still our major goal. But this allows us to also, with diversity and things like that, get into those neighborhoods that individuals would not have an opportunity to get in this profession and get them started. The ultimate goal would be to get them into as an EMT, and then have them move on to an EMT to paramedic program and grow them right to a paramedic. So,
And my final question, this might be for someone else, I'm not sure exactly, but the impact of Wesley not handing over as many transfers to the county we've had before, I'm sure it's helping us in terms of we're able to use our folks for other emergent calls, obviously. But my question is about the budget that ties into that. Do we see that impact anywhere in this proposal?
So, Commissioner, that actually is a good question that we brought up during manager hearings. I think right now what we've understood, and I'll defer to Kevin to talk more about it, but there is actually offsetting revenue that's coming in, I believe, through Medicaid that we expect to offset that. So would you be willing to?
yeah, the state passed the Medicaid fees actually increased to where they're 65% of the Medicaid or the Medicare base rate. So we did some projections on that based on our trends, and that would be about $823,000 estimated annual revenue impact for us. And that would help offset any losses. Like I said, it's too early to know the exact number of transfers we're going to be missing out on from Wesley and the revenue impact we're going to have on that. We are still, like I said, doing some, and we are billing them at the full rate. So, but that is some good news that was passed to increase our revenues. So.
All right, well, I have no other questions. I just want to make a comment. I want to say thank you for leading. I know we have a director position still trying to figure out that issue still, and we've had some turmoil in the past, and I think you've created some stability and some better morale in the department. So I want to say thank you for your leadership. I want to tell you, all the folks that work for you, I want to just express my appreciation to their great work to Sedgwick County. I know it's a very, very tough job. Everyone has a tough job, but these folks are really amazing people. So I want to say thank you for all you do.
Thank you for noting that. They do go above and beyond and have done a great job through difficult times, so.
Thank you. Let me follow up on one thing that Commissioner Howell said. I truly want an ambulance in Clearwater and in Cheney. That's the long-term goal. We don't have staffing for an ambulance in those two locations 12 hours a day, so we're having to use the CRVs right now. And what that provides is advanced life support. It's the most important, is to get advanced life support to those individuals, and we can get a bus out there to pick up the folks, but we have to have advanced life support, and that's what those two CRVs are providing for us. So I just want to, our long-term goal is to take care of those two communities, and I want to make sure that everybody's aware of that. Commissioner Lopez.
That's pretty much what I wanted to say. It's just that I want to be very careful when we talk about how often our CRVs are there versus not there. They are there 70 to 75% of the time on average right now. There's a lot of conversation around that. I mean, like you just said, we just went to the Clearwater City Council to speak with them the other day, and we meet with their mayor pretty regularly, so we can have these conversations to make sure we're doing everything we can to have services there. So I just want it to be very clear that from the bench, we are not looking past them in any way. We are trying to do everything we can to have that service there as often as we can, but they are not never there. And putting that out, I think, just kind of helps circulate rumors that aren't necessarily true. So I just want to make sure we're very clear on what we've been trying to do and directionally where we're going. Thank you.
Just as a follow-up comment, then I think rather than, it sounds anecdotal. I heard things and you've heard some things, and I think the data needs to be clarified. So if we can get that data to find out what is our status in terms of how often are we there and that type of thing, I think the data would be very helpful to clear up any.
Like I said, we have data to tell you how many times, they're there staffed, that what days they're staffed, what days they aren't staffed. The difficulty in getting the data of how many times, like you said, they're coming in to fill, things like that, that's a little more difficult because that's not really tracked through dispatch or anything. That's not a call that we can look up to see,
How about this? Let's look at the call volume in those communities and find out what our response times are to those communities. That would help.
That's all in that's all on our dashboard. You can zero it down to Clearwater, Cheney, Mount Hope, any town that has calls and all those response times. And there's a tab for CRVs on there too, and give you the CRV response times and the ambulance response times.
My interpretation of that would be if they're staged in the community and there's a call in the community, they ought to be pretty quick, and so we ought to be able to see that. So
and they do respond to the areas right outside of those in the rural areas also, not just those cities, to the rural areas also.
Thank you.
If it's okay, Commissioners, I just want to jump in. We are running pretty short on time. We have another 5 departments to get through, and this wraps up at 3:45. So I was going to see if we want to have a continued conversation on that CRV issue or anything, maybe we can schedule a workshop, if that's okay. Try and keep moving along.
We're going to keep moving on.
Thank you.
But, Kevin, your job is so important to the community, so I don't feel bad about spending some additional time out here. We've been in the newspaper continuously. I want to make sure that the community knows that we support what you do. We are looking at it every day. There's a lot of things go on behind the scenes, but we are definitely support EMS and your job. Thank you.
Thank you.
Okay, it looks like we got fire department. And how is our chief doing? He's not with us today.
Good afternoon, Chairman and Commissioners. Chief Williams sends his best. He's watching on YouTube today. He would really like to be here, but he is not quite yet able to make it in.
Very good. Well, tell him we wish him well.
Absolutely.
Thank you.
So Sedgwick County Fire is an all-hazards response organization comprised of 9 fire stations that respond 24 hours a day, 7 days a week, 365 days a year by our professional firefighters who are all credentialed EMTs, advanced EMTs, or paramedics. We protect about 618 square miles and have just over 70,000 residents. We do that through our workforce strength of 145 FTEs. We currently only have 4 vacancies, which I'm very happy to report to you. We do plan on having a recruit academy in the fall, and we'll get the balance of those filled out. We only have a couple of vacancies currently. 2 of those are part-time positions. One of them was a result of COVID and that part-time person not wanting to come in. But we are very healthy staff right now, although we do have some retention concerns, which I will address here shortly. Our strategic goals are in alignment with the public safety strategic goals. Strategic goal number 1 is identifying opportunities for consolidation, which improves service delivery for all of our residents and the public in general. We do this by our increased communication and collaboration with our area fire departments, including not only Wichita and Derby, but also the Class 2 and Class 3 cities that have volunteer fire departments. We're also enhancing cross-agency training in those departments with us so that we all can understand the similarities and the differences in some of the tactical things that we do from a fire response perspective. Strategic goal number 2 deals with recruitment, and some of the things that we're doing now in light of COVID lighting up are considerable. We're getting back out into the high schools, we're getting back into the community colleges, doing career fairs and partnering with local communities as well as local fire departments looking for opportunities to bring people over to work for the fire district. We also understand that HR and the manager's office and eventually they'll get you a recommendation for what our pay scale should probably look like. We think that that's going to help out quite a bit in the recruiting perspective. Goal number 3 is retention, and this one's kind of busy. There's a lot here. Retention isn't just about pay, but I'm going to spend most of the time talking about pay. We do other things, and Chief Williams and his staff spends a lot of time talking to our folks about our culture and the great things that happen in the fire district and why people want to be here and want to work for the fire district. We do things like promotional test processes that are collaborative, keeping people engaged, promoting our job satisfaction, as well as providing fire and medical training opportunities to folks. But we do need to explore those pay options. That is something that is obviously in the forefront of all of our minds. We know that we're around 14% behind our peers in the community. A quick look at some of the data suggests that Topeka, Lawrence, and Wichita, even Derby, are ahead of us. In fact, we just lost one of our employees to Augusta Fire Department for pay. Our folks that have been hired in the last 5 years are essentially earning about the same that people just beginning with Wichita Fire are making. So we know there's a pay issue. We know HR and the manager are working on them, and eventually they'll have a proposal to you to help us fix that.
Well, we're still on that, Chief.
Yes, sir.
A year ago, I promised everybody we were going to go to steps and tracks. Where are we at?
I think that's what Chief Chris was referring to. And I don't know if Sheena's behind me or not, but she might want to come to the podium or we pass her a mic and she can weigh.
Consultant right now, and they are looking at moving the fire and the EMS departments to a step plan. We just have not received information back to present to the commission yet. So we are still holding on that, but that is the plan.
Okay, but that was a year ago that I asked for this. Why has it taken so long?
So I would have to go back and look at our timeline. We did an RFP to select a vendor, and we are under a very tight timeline, if you will, so we can get everything out for budget. As soon as we get that back, we will present it. It just takes time because we do comparables with other organizations.
But if you're the one that's drawing that salary, why taking time, why it's kind of concerning.
We're working as fast as we can.
We had a lot of firemen and women sitting in the audience, and I sat here and looked them in the eye and said, we'll go to steps and tracks. So,
and we are working on it.
I want to keep my promise.
Yes, understood.
Okay, thank you.
And Chairman, Chief Williams has been very involved in that and talking to them and asking for their continued patience, and they're very aware that HR and the manager's office are working on that as well. So,
Can you just describe the 2 columns there on that chart, please?
yes, sir.
There's a middle column and a right column on each of the two blocks down below.
So not all fire departments do exactly the same thing. For example, Topeka, under the firefighter range comparison, have steps. And so the left-hand column would be the beginning pay for a Topeka firefighter, and the right-hand side of the column is their topped-out pay scale, however many steps they have within their pay scale. Lawrence does steps, Wichita Fire does steps. Derby is actually similar to us in that we currently just have a range. We don't have steps. And then the same thing can be said for the lieutenant's column, except Topeka does something different. They just have a set rate for their lieutenants. There's no up or down from that point. Lawrence has steps, Derby has a range, Wichita has steps for lieutenants, and then we just have a range.
Okay, thank you.
Yes, sir. Goal number 4 is mental health and substance disorders, advocating and working collaboratively with our health and human services throughout the community. We've got a couple of different things going on here, working proactively with our EMSS systems partners and human services partners to support any of the ICT-1 efforts. We are looking at mobile integrated healthcare and telecare options through an ET3 program through our firehouse replacement program. And we currently had just signed up for a Community Health Connections partners in IRIS, which talk about integrated referrals and intake systems to where we can make referrals to community partners, and we can also receive referrals to the fire district. Goal number 5, under criminal justice reform, we're going to support the criminal justice program through thorough fire investigations, working proactively with the sheriff's department as well as the district attorney's office. We're actually going to send one detective to fire investigation training this fall. We're trying to get one of the prosecuting attorneys there as well, and we're going to sponsor that. And then using our Wi-Fi initiatives to help prevent the crime of arson from happening, getting to those juveniles and youth before it becomes a problem. Strategic goal number 6 is communication and developing those competencies to facilitate appropriate communication. We do that in a lot of different ways. For example, we're working with our members in all ranks, firefighters, lieutenants, captains, division chiefs, and whatnot, in a number of different committee work, including promotional and awards committees, rehab committees, and apparatus design. We're also developing external agency communication sharing, again, through our firehouse replacement program. And that's work that's being done with EMS, 911, DIO as well. And then finally, strategic goal number 7 deals with our first responder care. We continue to develop our peer support program. We're also working with risk management, looking at new hire physicals, as well as injury prevention for current employees. And we are just getting ready to launch the Cortico Wellness app for our folks. The sheriff's been using that for a while, which will lend help to family support, financial fitness, psychological first aid, and some other good things that happen. Some of our challenges and opportunities for the 5-year horizon. Obviously, we have recruiting, hiring, and retaining quality firefighters up front. I've already talked about the pay issues, so I don't want to harp on that too much, but we do want to also get people in the door that want to be here, and that's why I talk about quality firefighters. We know that 9 of our last 18 employees who have left because of pay. The good news is 7 of those 18 left because they retired. So we want to get good people in the door and keep them. We were unable to completely fill our recruit academy last fall. We tried to hire 9. We could only get 7 in the door. And so we want to stay ahead of that. We don't want to have a bunch of red and yellow boxes on our organizational chart and keep our firefighters in the fire stations ready to respond. We want to continue our fire education and in-house training. Things like COVID-19 and even something like the recent tornado strike has highlighted the importance of having those intra-agency training opportunities that we have with Derby and Wichita and our Class 2 and Class 3 cities. The response has been phenomenal, especially in light of the tornado strike and the things that happened immediately after that. We want to stay in front of the carcinogen exposures, which we continue to do. as well as pay attention to the complexity of the repair and replacement of our apparatus, which will be a problem that we need to be addressing in this 5-year timeline. It's getting more and more complex, more and more expensive, and harder to work on. From an opportunities perspective, we continue to work on functional consolidation programs with not only Wichita Fire and Derby in the Class 2 and 3 cities. We've done a lot with the Enhanced First Responder Agreement. We have done a ton of functional training with them. And now that COVID has let up a little bit, we're starting to get in the fire prevention door and get back out into the schools. We're planning our activities at the zoo in October again this year, and we're looking for that to really open up. We continue to mitigate carcinogen exposures and provide opportunities for physical and mental well-being through our peer support programs and the Cortico Wellness app. Our budget request for 2023 is in front of you. You'll notice a couple of things, like for personnel, you'll see a reduction by 6.9%. The vast majority of that has to do with the fact that we've only got 26 pay periods coming up in 2023 instead of 27 pay periods. You'll notice a large increase in contractuals, and that's due primarily to an increase in our contingency funds. That's going to be about an 18% of our budget is in those contractuals, about a 5.5% contingency to reflect our budget numbers. And then our debt service is due to the purchase of a few heavy apparatus that we are working on this year and receiving next year. So our overall ask is $21,040,311, which is a 0.88% increase from 2022. We only have one decision package for your consideration this year, and that is a training position, a training officer position. This training officer position would train and coordinate efforts with WFD as well as Derby Fire in our Class 2 and Class 3 cities. They would coordinate training, recruit training, department fire and emergency training, as well as liaisoning with those departments to help develop and continue to foster interagency training. Both the recent tornado strike and COVID-19 have highlighted the great work that has been done these last couple of years, and we want to keep that momentum going with them. The request total is $156,274. That does include full benefits as well as the purchase of a vehicle. So the position only cost is around $116,000. We've been double filling this position since 2020, and we want to keep that momentum, and that's why we're asking to create it as a full-time position. Here's the decision package cost for you, and I would be happy to answer any questions you may have.
Hey, do you have to have a captain doing this? Because on your previous slide, it says the lieutenant gets paid $44,000 to $66,000, and you're taking, we're jumping up to a captain. And
we currently have a captain filling that double fill spot. Not saying it has to be a captain. We could look at the range. Not all captains come in at the low end any more than they all come in at the high end. I think the work is what's most important. I don't know that it has to be a captain's position, but it would seem like the complexity of that position and the things that they're coordinating with the station captains and the division chiefs probably put it at about a captain's rank, sir.
And how much of this $156,000 is the vehicle?
I think I figured it being around $45,000 for the vehicle, which of course, vehicles last us, those staff vehicles last us about 10 years. So that wouldn't be a reoccurring annual cost.
Okay. Commissioner Howell.
Thank you, Chairman. So along that line, this is kind of it's kind of like an intergovernmental position. Do you agree with that? Between Wichita and Derby and other?
Yeah, similar.
Any chance for intergovernmental agreement that would be sharing the cost of this?
Well, let me say this real quick. So we are currently co-hosting a live burn training scenario right now, today, earlier this morning, not currently at this minute. We have 2 people down there that are providing that training. Wichita Fire is providing 3. Because it's live fire training, it requires a lot of different safety pieces. So a lot of the training that is going on is actually being shared amongst those jurisdictions. Whenever we go out and train with the Valley Centers and the Cheneys of the world, they also provide those training partners to help make the numbers because you have to have so many people in place to provide that training. So it's not like we're just providing all of it for free. They have skin in the game as well. It could be in materials and commodities. It could be in people.
Okay. Let me change horses here. On the overtime page, it looks like you had about 26,620 hours of overtime. Curiously, is that calculated on 2,080? Is that 2,080 hours per? How do you calculate that number? Is that happen to be? Because the firefighters normally work 2920 a year, not 2,080 hours a year. So how is that calculated?
So these are the hours that were actually paid out as overtime, so it will take that into account depending on whether it was a fire mechanic who may have a more regular schedule versus a firefighter versus maybe somebody who's up the chain. So it's just based on their normal schedule, how they were really paid overtime. These are actuals. So it's not anything I computed. It came directly from the system based on when they logged in and logged out for their hours.
I'm still a little bit confused. So if a firefighter works an extra day, they get an extra day's pay, but there's always a bit of a disagreement over, I understand what I'm saying, because they work every third day, and so a salary for a year, that's 2,920 hours a year versus someone else who works 40 hours a week, that's 2,080 hours a year, and the difference is easy to calculate. I mean, so if they work an extra day, are they getting their normal rate they would normally get for a normal 24-hour day?
So it is, if they were working in a biweekly pay period status, depending on what days they were on and what days they were off, if they qualified for overtime in that period, this reflects those hours. So our system is smart enough to know what hours to count as overtime and what hours not to, just based on their schedules that are logged in. So these are actual overtime hours paid where we paid time and a half.
So it's interesting, you started off by saying you basically have full staffing, which is great, but we have about 9 firefighters of extra pay going out for a year in overtime because of some reason. So that's a lot of money to pay that much overtime. Do you want to comment on that?
Well, so of course COVID-19 didn't help anybody, and we have seats to fill, we have staffing goals, and we try not to take apparatus off track. You also have to remember, Commissioner, that overtime for firefighters is based on a 27-day pay cycle. It's not based on an 80-hour week like it would be for somebody like myself. And so overtime isn't always time and a half. Sometimes it's straight time. But the number of hours of overtime is divvied out amongst the entire department. There's mechanics, there's 40-hour employees, as well as 56-hour employees that do accrue overtime.
Yeah, what you just said in a different way. I said it basically a number of hours a year, 2,920 hours a year is a standard firefighter.
Yes.
Man year, okay. The other thing I'd say is, number one goal being consolidation. As far as I know, we haven't made any progress on that at all. I mean, it's just, I hate, that being the first priority on this list is just a little bit, I don't even know what to say any longer. We're not making any progress at all.
A couple things. First of all, on the issue of overtime, EMS and fire, these are generational numbers. These are historical numbers. There's nothing, we're looking at numbers across everything from 2008 on. Historically, we've always paid a lot of overtime in fire and EMS. It's just the nature of the game. So if we were going to look for a strategy to reduce those numbers, then you're going to look at some staffing issues. And I might mention that Kevin and Laura both asked in their budget for more people. They don't feel like they have enough staff. But to Chairman Dennis's point before, until you can get filled what you have as openings, it's kind of a moot point. So I think they all understand that. On the consolidation issue, I think the strategy right now, and Brad can chime in here, is to look for every functional piece that we can consolidate to ease the way for our larger administrative consolidation down the road. And I think that's our strategy right now. And it's probably time that we have Brad and Doug, when Doug is up and around, to come back into the commission and give you a thorough briefing on everything that's been going on behind the scenes to move toward that direction of a consolidation.
When I was going to leadership school and I ended up getting a degree in leadership, all my degrees I have, but we talk about SMART goals, and I look at these goals here. None of these goals that I would say are specific, measurable, achievable, relevant, or time-based goals. I couldn't tell you if we actually achieved these goals or not. They're goals, but I have no idea how to develop a strategy and actually actually give a status on each goal. Where are we moving along? How are we making progress on these goals? I have no idea. the consolidation thing is really just very frustrating. So I'll say this, you and I and Chief Williams sat down when you first came on, about 2-hour-long conversation talking about consolidation over time. I have not heard a word about that. And as far as I know, Commissioner Lopez has never heard this before. I'm not sure about Commissioner Cruz has ever heard it before. We're stagnant. We're not moving forward. And I'll just tell you, if you haven't heard it, I know Mays is in conversations right now about making their own fire department. I've heard it lots of times. People keep telling me this over and over again. And if that happens, this fire district is going to have serious problems because it begins to collapse at that point. We can't just add more cost to this fire district and not realize that we're incentivizing smaller cities like Mays to find another solution. Hayesville, Bel Air, Goddard, they're all struggling right now with paying nearly 18 mills of property tax for a single public safety service. We've got to be very careful, and we're going to capture the assessed growth value, increasing assessed value growth. We know that's where the budget's probably going to go, and we're incentivizing them to pull out. We're not solving this efficiency issue, and we really have to have a conversation. So I'm not upset with you at all, Mr. Chief Crisp. I'm just concerned that we're not making progress. And right now, the firefighters, I love them, want them to be rewarded for their work. But when you have this much overtime, that money could be spread out in salary, for example. The number of hours they do work, they could have more money in their paycheck, but we're using the money on overtime instead. So we're paying 9 people that actually aren't even there. It's going out in overtime, for example. Does that make sense, Mr. Manager, what I'm saying?
Whenever you run into large overtime numbers, that's the mathematic you begin to use, is what can we do from a staffing perspective to drive, we know the number will never be 0, but reduce it considerably and be as efficient as we can with staff. You're spot on, sir.
Exactly. So anyway, I talked to the firefighters. They're what they really don't want to see us do is increase our mill levy. I don't think that's even possible. Because I think cities like Mays are likely to pull out, and then other cities may follow. This fire district is, I've said before, this fire district is a house of cards. As long as we continue doing what we're doing right now, it's just a matter of time. And I'm just very concerned about the long-term effects of continuing to budget the way we're budgeting the fire district right now. I want them to be rewarded. I want them to have great paychecks. I presented an idea of consolidation over time that actually works very well. They would all get raises, and we'd actually solve this problem forever. But no one's having a conversation at this point. We talked about this for a couple of hours 2 years ago, and it's gone nowhere since then. So with that, I just want to say I'm very, very concerned about this plan. Thank you, Chairman.
Thank you. And I've heard about Mays myself, and I'm concerned. And it's the same concern that I've had since I've been a commissioner, is that we incentivize small communities to have a volunteer fire department because we're going to show up, and so they're getting our service free. And I've said it over and over again, that is not fair to the people that pay 16, 17, 18 mills for fire protection when we show up to all of these small communities for free. So until we solve that problem, we're going to continue to have communities just thinking that it's cheaper to go someplace else than it is. So I don't blame Mays for even considering it right now. And if they do consider it, it's going to hurt us. So we got to make sure that we take a good look at all of these different agreements that we've got across the board, because every single one of these agreements are hurting Sedgwick County Fire District number 1. So I want to make sure that that's plain. Commissioner Lopez, I've got something else afterwards.
Okay, thank you. It does seem like the consensus from the county's perspective is consolidation is going to be critical going forward between Wichita and the county. But I am curious, because we're only half of the equation, where the city sits with that. What does their city council think? What does their management team directionally want to see? Because if they're not on board, we can't force them to do that. So I am curious. And I know we don't have a whole lot of time right now to open that discussion up, but maybe we could have a meeting on that, because we can push as much as we want, but until the city's ready to join in on that, there's just nothing that we can actually do. Thank you.
Thank you. Commissioner Cruz, and then I've got something at the end.
When did we have that last meeting? We've already had a meeting with the city about this. When did that take place?
Everything's in relation
2019?
to,
I mean, it was
pandemic,
my first year, I believe. Yeah. So I think at some point, I know that we all kind of got a little frustrated, I would say, just because we kept having this conversation, but it was Sedgwick County always bringing it up. And so at what point do we shift efforts and start thinking about other things if we're the only ones that have been pushing this since I started in 2019? So those are my comments. Thanks.
Let me make my statement first before I forget it, okay?
Yes, sir.
Excuse me. One of my goals and jobs as a county commissioner is to be a cheerleader for Fire District Number 1, just as I'm a cheerleader for every one of our employees here in Sedgwick County. One of the things that actually helped me early on, and I don't know if all the commissioners don't want this information, but early on I used to get an email every time you all went out and fought a fire, and it told us which unit showed up at that fire, who was in charge, which sides of the house, and I had to get a primer so that I could decide what side of the house it was, because you had different terms on which side of the house you showed up on. But it let me know that what you all were doing, and it let me be a cheerleader. When you'd leave the county and go fight a fire over in Reno County, when you went over to Butler County the other day, Commissioner Lopez and I sat down and we talked to all your firefighters who were over there in the parking lot. But we're not getting that information anymore. I don't see those emails. Now, maybe the other commissioners don't want it, but if I'm going to be a cheerleader for you, I do want it. So I need to say our firefighters are working. They're going outside the county. They're working inside the county. They're doing great things for us. So
Yes, sir.
I don't know why that I don't get it anymore, but I don't. So.
Okay. I'll mention something to Chief Williams, who I'm sure is watching this right now, taking notes like I am.
All right. Thank you.
Yes, sir.
Commissioner Howell.
I'm just like to touch the elements of my idea. Again, I'm not saying this is the right idea, but it's an idea that needs to be understood by all of the commissioners and needs to be seriously considered, I think. But the idea would be actually would lower the mill levy quite a bit. And it's based on the idea that, again, fire departments are based on general taxes, we don't use user fees like we do on EMS. General taxes pays for fire. But there are many jurisdictions around that are getting free services and they're not paying for it, and that's not fair. And taxes should be fair. We all believe that inherently. So the idea is that we would lower the taxes, we would put the cost where it belongs. We actually have countywide taxing authority. We can do this. And I actually had our legal department check it out. They spent quite a bit of time on this. We went to WSU and came back with a report and says it can be done. So we know it's legal. We know it's feasible. And at the end of the day, we would stabilize this department. It would create some fairness that and no one would see a reduction in fire protection services. Firefighters would get more pay potentially. At the end of the day, all these goals are good goals, and it doesn't require any city to give up their sovereignty. If they don't want to, they don't have to. So it continues to support their home rule authority. This all can be done. But we can't just throw these ideas away and say we're not going to spend time trying to work it out, because I think this is a house of cards. And so with that, I just want to say I'm very, very concerned. I want these folks to get great pay. But, for example, we talked about what does it cost for Wichita to have fire protection services in Wichita? It depends on who you ask. And I've talked to Lindsay. If you look at the one side of the equation, it's very hard to answer the question. Look on the other side, the expenditure side, you can answer this question in one day.
Mm-hmm.
I've been asking this question for 5 years and haven't got an answer. It's not that difficult to get an answer on what's it cost for fire protection services in Wichita. Look at the expenditure side. It's essentially just it's a very, very simple question, but no one wants to answer the question. And so when they think their mill levy over there is 7 mills and ours is 19 or 18 mills, we have a real problem. But if theirs is 13, 14 mills, and we could get ours down to 13, 14 mills, it takes care of the problem forever. And that's the answer. We've got to get to that equal status with Wichita. Thank you, Chairman.
Thank you. Well, Chief, you had a long time on today, but I don't see any more questions.
Okay. Thank you all very much for your time.
Thank you. Welcome, Doctor.
Commissioners, thank you for having me. I'm Dr. Kevin Brinker. I'm the current interim medical director for the Office of the Medical Director, EMSS. My budget is fairly straightforward. I have no personnel issues and let's see, so it basically, my department is just basically me and my program manager, Colonel Derek Ruddle, who's my program manager. We oversee credentialing, but that particular position is under the umbrella of emergency medical services at the moment. Our strategic plan is pretty straightforward. It's to offer medical direction, bringing us up to date with evidence-based medical changes in the pre-hospital phase of medical care, to maintain response readiness. That includes developing protocols, training programs, credentialing, and on-scene supervision when necessary. We are going to try to expand that out to interagency type training programs to get that ongoing. Again, COVID kind of took that out of play due to the quarantine or the not having the ability to meet in group. To increase interdepartmental communication that not only includes the system partners that we currently provide medical support to, but the hospitals as well as the Board of EMS. Currently, we're overseeing EMS, County Fire, Wichita Fire, PD, SO, and Airport Fire and Safety, as well as our surrounding areas of Sedgwick, Colwich, Clearwater, Mount Hope, and Textron. And eventually we'd like to become, as we are the leader in the state when it comes to pre-hospital emergency care, is to open up our facilities and our expertise as a regional training facility. Challenges. The biggest challenge that we are facing right now is protocol. There's not been a protocol revision or an update in the last 12 years. There's been short little updates here and there, but nothing to bring us up to date and on guideline with what the state is requiring. So I'm working closely with EMS and the state to make sure that we're compliant with the current standards. We're going to advance pre-hospital medical care to all of our system partners. We're also interacting with all of the local ERs in the area, in the hospital administrations, to develop programs not only for review, identifying problems and what treatment modalities that we can also increase, but as far as STEMI to cath lab, enhancing trauma care with not only Dr. Acuna, but Dr. Hahn over at Francis and Wesley. And then we've also started the initiative with local law enforcement to provide Narcan to several of those agencies right now. I'm the medical director behind that as far as Narcan for Wichita Police, County, Sedgwick County Sheriff's Department. We're expanding to Mays, Bel Air, Park City, and Hayesville. And I think others will kind of fall in line as we go on with that because the opiate endemic isn't going to get any better. So we're working with that as well. And providing, and then when we talk about increasing or working with the system protocols, all the system partners are involved with that. So we're making it a group effort. I have no decisional packages. Most of those were taken away. What I do have is our budget. Now, there's been a change with personnel. That has to do with prior contractuals with other personnel, Mr. Leeds, or I'm not sure who's going to address that, but basically the budget hasn't changed a lot. We've actually been able to decrease it as far as travel and other expenses. So we're running pretty lean and mean at the moment, trying to get things under control. So like I said, my package is pretty brief and to the point. So any questions?
Thank you. Do you provide the Narcan training to the different people that are administering it?
We do have that available to them. We've been working with the agencies that have really come to us is a group called DCCA. That's out of Lawrence, and they have they're providing the training, and they have a very extensive training video and program, robust program that I've personally reviewed and agree with. But we also provide that as needed with our professional development team through EMS.
Okay. Are you training our sheriff's deputies to use it also?
We have done corrections. I'm not sure where we're at as far as the deputies are concerned, but I know that the PDTs did do that for corrections.
Okay. I don't see any questions. Thank you.
All right. Thank you.
Afternoon, Julie.
Good afternoon, everyone. Julie Stimson, Sedgwick County Emergency Management Director. My requests are going to be very minimal for this forum. Majority of our concerns and challenges, as you'll hear, are going to go through the CIP process. I'm happy to report I have 100% staffing. Last year we did a decision package to get our logistics person. It is filled and it has proved to be very valuable with this tornado response. So I appreciate the decisions that were made last year. It has proved it's worth this year. So our strategic goals are 5-year strategic goals. Underneath each of these goals, we have very specific key performance indicators that have measurables, but just for sake of time, our goal number 1 is to serve as the Sedgwick County's leading expert in contemporary emergency management strategies and practices. Number 2 is to inspire a whole community, all hazard preparedness and resilience through active volunteer programs, outreach and education efforts. I have a list of volunteer organizations that we have already brought back to life, and of course our community emergency response team is in the works right now. Goal number 3 is to ensure optimal disaster prevention, preparedness, mitigation, response, and recovery through active stakeholder participation in emergency plan development, training, and exercising, as well as multi-agency coordination of response and recovery through a Ready State Emergency Operations Center. We have executed pretty much all of this within the last week. Challenges and opportunities. Our opportunity for change, we've already kind of started with the CIP with our outdoor warning system. With an approved 6-year CIP to replace the outdoor system, we can save costs in annual charges, and the same CIP that we will be proposing would increase coverage from 92 to 98%. Another challenge with our volunteer teams, especially with the CERT team, is time and resources to coordinate trainers and volunteer training classes. Most of them will be held on weekends in all of our communities, so this will definitely be a time-consuming task at hand working with our jurisdictions. And then a challenge, which again through a CIP process, is that need for a permanent disaster preparedness or PPE warehouse. You'll see some changes in our budget. The personnel cost, someone else had mentioned, is due to the different pay periods in 2023. Our contractuals and commodities, we got a new vendor, new contractor for our outdoor warning system, and things have changed within how we bill and how we code some of our expenses. So that's the change between the contractuals and commodities. It's geared around our outdoor warning system. Another change that we have is through one of our grants, we're going to be asking for less grant funding for our hazardous materials exercise program. In 2022, we had full-scale exercises. This year, we're more focused on training, which is less need for funds. And that is all I have. I stand for any questions.
Well, thank you. Just a clarification. Here just a month and a half ago, something like that, you came and briefed us on outdoor sirens. And at that point in time, we saw that we don't have full coverage throughout the county, and we were aware of that, and we are looking at what kind of things that we can do to correct that for the future. I was dismayed, was probably a very calm word, at the reporting in the Wichita Eagle, which obviously is trying to sell newspapers instead of report the truth. And it said that we put sirens where the people are rich and we don't put sirens where people are poor. Can you address that calmly? Because I can't.
Absolutely. That is not a factor. We're looking at congregation areas where folks will be outside away from technology that need to be warned of incoming weather. We know we have some coverage gaps, but we can't put a siren in everyone's backyard. So it's a calculated, coordinated decision on where these sirens go based on what we can afford, where we have folks outdoors. And it's not an easy decision. We don't just put sirens in grounds. There is a very calculated conversation that happens with multiple smart people in the room that are very familiar with sirens and coverage. Each siren in ideal conditions will provide about a mile radius of sound, but again, under ideal conditions. When there are storms and things, they're not going to necessarily provide that coverage. Again, while we reiterate having those multiple layers of communication. We do know not a single system within our outdoor warning is 100%. So again, that's why we always reiterate that things need to be layered and there needs to be multiple ways.
Very good. Well, Commissioner Lopez and I both spoke to the individual that, and he wasn't the one that said that we put it in poor people's areas, but we spoke to the individual that was inside of his home and did not hear the one that was over at Southeast High School. And he was able to talk to Jonathan, and Jonathan explained that same thing you're saying, is that these are, if you're outdoors, they're designed to be able to help you identify that there is a tornado possible in the area. They're not designed for indoors, and this individual was actually indoors when he didn't hear the siren. So I guess I just want to, I guess I was torqued when I read the Wichita Eagle. That's very polite.
We were as well.
That wasn't the words that I was using as I was reading the article. But if you look at my district, for example, you can go for miles and not find a siren. And everybody keeps telling me my district isn't poor. I keep trying to tell them it is kind of poor, but when it comes to aging, they keep telling me I'm rich, so I guess I'm kind of confused. But the bottom line is that we are already looking at where the sirens are placed, and we do not place sirens solely to make sure that the rich are protected and the poor are not. I want to make sure that's clear to the Wichita Eagle. Thank you.
It is not a factor in our decision-making whatsoever.
Thank you. Commissioner Howell.
Thank you, Chairman. Just one of the comments on the page here is that you're moving coverage from 92% to 98%. Is that based on population?
Yes.
Certainly not square footage,
Correct.
not square area.
Correct.
It's by
We have a sound analysis that's already been performed with our contractors who's weighed into populated areas, a noise competition from roads and buildings. So there's been a giant analysis, very in-depth, of where we may have some gaps, where we may have some folks outdoors.
So we're currently at 92%.
Correct.
And some of the sirens, I understand, have a lower sound range than other sirens. Do we have any plans to just update those so they have a...
Well, and that's part of, so we currently have a CIP. It was mentioned too that we have a CIP that can add 5 sirens a year. We're having, and it's also to replace sirens, and we have a lot of sirens that need replacement. So we're having to use that fund to fix what we currently have in the ground, which is challenging us to add more to the system. And this is why we've created this new CIP that we'll be proposing in the future, is to help stop that train, because we're never going to make headway if we're continually using those funds to just replace broken equipment.
So is population density one of the things you look at when you place a siren?
Yes, we work with our GIS folks, and we look at, because we have communities that are expanding, so we're looking at all of that, and that's part of our decisions. That's part of the partnership of making the decisions on where they go.
And I imagine coverage gaps are also another factor as to where you place new sirens if you're going to place in a new one?
Correct. Yes, we already have a map available. It's all part of this new CIP that we'll be bringing forward.
Okay, so again, data-driven.
Correct.
Coverage gaps and population density are major factors in how we place those. Good. I agree, and I've had long conversations with multiple I don't know how many reporters call me on this. Again, most of this damage, in fact, I think all of the damage this time, going back, I think 5 tornadoes now, they've all gone through District 5 for some reason. I don't know why that is. And I'm not saying other parts of the county don't have vulnerability. They do, obviously. We don't know why the tornadoes go where they go, but it happens. It's just a fact that it's happened in District 5, I believe 5 times in a row now since 1991. Having said that, it has hit Oak Lawn, for example. There's lots of smaller homes there, did not have basements, did not have storm shelters. In this case, the homes that it did hit out on the edge of Sedgwick County, those homes were not They were not anchored to the ground. I looked at that myself. They were not anchored. This might be a question for the next briefer here, but we have homes out there sitting on foundations, just sitting there by gravity. There's nothing holding them down. And some of these folks don't have. Some of these folks have language barriers. Some of these folks don't have smartphones. They may not have internet. And so I speculated. Okay, I made comments that there are some people out there that are very educated and they are very aware, the weather aware, and they have multiple ways of being warned about inclement weather that can be very dangerous. Other folks, for whatever reason, it eludes them, and they don't have as much awareness, or they may have education. They've not been trained to think this way. Maybe they're new to Kansas, and that was true at least for one family. They were new to Kansas, and they didn't know what a tornado siren even was. Even if they did hear it, they didn't know what it meant. And so, at the end of the day, I use the word vulnerability, which I guess you're not looking at, but I think vulnerability is a tornado. A mobile home park is much more vulnerable than maybe an area that has lots of basements and people that maybe have been. They have emergency planning in their mind. When they see inclement weather, they plan ahead. So again, speculating, trying to figure out where we put sirens. It was not a comment saying that if you're rich, you get a tornado siren, if you're poor, you don't, or vice versa. That's not what I said. Okay? Everybody got that? That's not what I said. Where we place sirens has not been driven by commissioners in the past. It's been driven by staff who picks the right places to put these based on all kinds of factors that are not picked politically. They're picked because of other reasons, like population density, for example. There are going to be coverage gaps in the county because there's places in the county that's very sparse. And I would argue that this is a very, very old system that has evolved over the years. But today, in the 21st century, we've got all kinds of ways of learning about dangerous weather today we didn't have 60 years ago. So the importance of this system is still important, but it's not the only way that we learn these things. However, having said that, there are places that are more vulnerable to this day, and that's for a variety of factors. And I'm just going to say, based on vulnerability and population density and on coverage gaps, I think those are the things that ought to tie into where we place our sirens. Doesn't mean that someone who's wealthy or wealthy or poor should have a sirens because of that alone. That's not what I said. But I can tell you that if you have a very populated mobile home park without mobile homes anchored to the ground and no tornado shelters and a very high population density, I'd be very concerned about that versus an area that maybe has 2 or 3 rural communities, 2 or 3 rural homes spaced miles apart. It's just the way it works out. So it was not intended to be a criticism towards anybody. It wasn't. People read into stuff, and that's not what I said. So I'm sorry about that. But having said that, let's be clear. It's coverage gaps and population density primarily. Thank you.
Yeah. And I will share this is a challenge nationwide. This isn't specific to our county. How do you warn rural communities? Is a discussion that's being held at all levels, even outside of our state. So I just want to say this is a challenge through the emergency management discipline. And is there a perfect answer right now? No, but we can learn from this and do better.
And I'd like to add one more thing. Is there anything in the law that actually requires us to do any particular, we have a great warning system, but what does the law require us to do specifically to outdoor warning systems? Is there some threshold we're supposed to meet?
The specific from our Kansas statute is develop and coordinate a local hazard warning and notification system. Does not dictate how we go about that, doesn't require us to have outdoor warnings. The culture is really what drives those methods, knowing the population and what they have.
Well, I like your idea of being multi-layered. I think that's true. I think everyone understands. In fact, this tornado came through last week. It really didn't surprise very many people. A few people were surprised, but again, there's reasons why that happened. But for the most people, especially the folks in Andover, they were not surprised at all. They were watching it come, and they were very warned. And their phones went off, and sirens were going off for quite a long time before the tornado got there. So the multi-layered approach is really, I think, what is credited for saving lives this time. The people who were the most injured are ones that had very little warning and couldn't hear the outdoor sirens because of where they were. And even if they had been outdoors, they still wouldn't have heard it because it's too far away from where they are. And there's all kinds of other reasons as well. But thank you, Chairman.
Thank you. But we don't blow the sirens until we see actual rotation, correct?
We go off of the National Weather Service when they're watching their storms and we see rotation. When we start getting funnel clouds and they're pretty certain there's a risk for touchdown, they're the ones that will push out that warning, which sends out our tornado sirens and all of the other alerts that go through all the different systems.
Well, from what I understand, where that went down in eastern Sedgwick County, we got rotation and then we blew the siren as soon as we saw the rotation, but the time is so short from the time you see the rotation until you've actually got one on the ground that even if we were 100% perfect and we had one outside everybody's back door, we've got to know that we've got rotation before we blow them, because we're not going to cry wolf every time something happens.
And we had our EOC stood up. We were monitoring that day. We knew we were under a weather alert day, so we were monitoring, and this was one of those final storms leaving our county, and it did not show any signs of being a tornadic storm. And you'll hear several folks also saying even the news was kind of, not so concerned about this storm. So it did catch just about everybody, again, who were watching the weather conditions just because we had that threat. This was the end of our threat, and it just happened really quick and didn't follow what we were used to with tornadoes in Kansas. Usually there's some sort of indication of rotation that has us focused on it, and it just didn't happen. It just dropped.
Okay. So. Commissioner Lopez.
Thank you. I just want to tell you again just how much I appreciate all the work that you're doing here, but especially when we're looking at creating those, I guess when we're talking about like a multi-layered approach here, how can we get more involved with creating those emergency response teams? The one that I saw out in full force in Butler County and everything they were doing to organize was just incredible. So I'm really looking forward to working with you on how can we get those and specifically focusing on our non-English speaking residents as well. So I'm very much looking forward to that work. But to end your time, I just want to make sure that that we recognize that you just passed your Certified Emergency Management class or course. So congratulations on that. That's huge. And just wanted to say congratulations.
I appreciate it. Thank you.
Very good.
There's been a lot going on in the past few weeks, so I appreciate it.
Well, thank you. I don't see any more questions. Congratulations.
All right, thank you.
Appreciate it. Thanks for what you do. And now we move to corrections. We didn't think we were going to get to you today.
Good afternoon. Chris Morales, Department of Corrections. I think you can probably guess from our picture here what one of our major challenges is. Our workforce is at 66% strength right now, so there's 110.5 FTE where we don't have staff to fill those positions. We have lost 11 of our ISO positions to court services and parole. We've been talking about how that is one of our major competitors right now for staff. Of those that left, the longest tenure there was 17 years. And this person left saying, I can make more as a CSO1 than I can as a supervisor for corrections. I want to point out something that this chart doesn't say, and that's in our yellow boxes here, AISP and drug court, predominantly are ISOs, or intensive supervision officers. And just because we might have more, it's still not great for the staffing there or the workforce strength, but we do have 34% of our adult ISOs that are either vacant or they're filled with an officer who's been in that position less than 6 months. So the inexperience is of concern to us as well. So long story short, workforce challenges pose a threat to our ability to sustain programs. Our primary strategic goal is to reduce recidivism, and we do that by using proven behavior change strategies with our clients. We are moving to a 5-year strategic plan. Our prior director did start that planning process before she left. When she left, the decision was made to put a pause on that so that when you hire a new director, they will be a part of that planning process. And quite frankly, our immediate focus right now is on filling those positions. As far as our opportunities, we have kind of an exciting opportunity from the state of Kansas for salary increases. Just a reminder that 40% of our positions are funded by the Kansas Department of Corrections. We have also an opportunity for system changes. As the community task force is finished with their recommendations, we have individual work teams working on those, and we really feel that we could make some great system improvements and corrections. We are going to complete our e-correction system, which is our records management system, over the next year. And of course, again, once a director is in place, we hope to get back with our 5-year strategic plan. Our challenges, compensation discrepancies. And again, I mentioned a little bit ago that state parole and court service officers seem to be our competition right now. The starting pay for a court service officer 1 is $23.13. They're getting a 6% increase in July, and they're going to get another 5% increase for cost of living. The starting pay for a parole officer 1, which is a state employee, is $22.16 per hour. They're also scheduled as a state employee to get a 5% increase. The starting pay for intensive supervision officer 1s in corrections is $18.72. Another challenge, hiring. I'll just point out that since 2020, we've hired 113 staff, and we've had 162 separations. So you can see the disparity there. And management turnover and staff experience can best be described in using adult residential work release as an example. They have a 44% vacancy rate in supervisory positions alone. So supervisors are really unable to adequately supervise their staff. They're also serving on the floor in posts. Adult residential work release also has corrections officer positions, and they have 50% vacancy in corrections officers at that facility. You can imagine the overtime burden is falling to a smaller pool of people, and again, we're pulling intensive supervision officers off of their regular schedule to work the floor. And again, let me just speak real briefly to staff and experience. 67% of the current corrections officers have been with us less than 6 months. And out of that, half of them have been with us less than 90 days. So highly inexperienced staff supervising high-risk felony offenders in adult residential work release. This is our budget request for 2023, which is pretty much the same. The decrease is primarily in personnel. In corrections, we also manage the Crime Prevention Fund, and this was an RFP process that the Commission approved several weeks ago, and it's flat funding there. We have 3 decision packages. The first one I want to talk with you about is the additional funding from the Kansas Department of Corrections. The governor signed a budget bill for $2.6 million in state fiscal year 22 and $8.4 million in state fiscal year 23. This is for the purpose to increase staff salaries in community corrections grants. To our surprise, she also submitted a budget amendment that added $841,000 for pay increases. I mentioned earlier that the state employees were getting a 5% cost of living, so this is for our community corrections workers to also get that. So we know for sure that in state fiscal year 2022, in the 4th quarter, so that's April, May, and June of this year, Sedgwick County will get $440,000 from the Kansas Department of Corrections. Our unconfirmed estimate is $1.7 million for next fiscal year. So we have a great opportunity to make this a priority. Again, I'll remind you that 40% of our staff are funded by Kansas Department of Corrections. The rest of the staff are either funded general fund completely or a combination of. So we have intensive supervision officers and corrections officers funded by both. That's why this is showing up as a decision package. I will tell you that for the April, May, and June funding, the $440,000, KDOC is being extremely flexible in letting us spend this money. They have said we could do back pay back to April for staff. They also have not told us which positions under the grant are eligible or ineligible. They said that's a local decision. And they have also lifted their restriction on bonuses. So they will allow bonus pay for April, May, and June. Not sure that that ruling would carry on into next fiscal year. It is a high priority need within our department, and we are working with HR and Finance to develop a specific compensation strategy for this funding. Our second decision package has to do with e-corrections. This is a position that was in partnership with IT. We are proposing that there's a reclass on an administrative support position that we have to an applications manager. That is quite a bit of a difference. It's a grade 123 to 133. So to help with the difference, we have identified an assistant ISO position that's currently unfilled and not needed in one of our programs that we could eliminate to help with this. This would be very similar to a customer support analyst that we have, where corrections pays for it and IT manages it and prioritizes corrections projects. This person would do the same thing as an application manager with our records management system. And then finally, we have decision package 3, which is an increase in rent. Juvenile Field Services has rented space at 3803 East Harry since 2009. The landlord there has provided us notice that he will not be renewing our current lease in the current space where we're at Field Services. Our current rental agreement is for $128,307 a year. He has identified additional space that he'd be willing to remodel and rent to Sedgwick County, and it's located at 4185 East Harry. That rent is $185,031 per year. So you can see that the rental cost would increase for that new space by $56,000, almost $57,000, and then we'd also have to pay utilities, which currently the utilities are included in our rent. So what I'd like to say about this is come January 1, we'll either be in this new space, or if there is other space available within the county current buildings, we certainly are open to that and are working with facilities to identify that. So again, these are coming forward as just some options, but it is a move that we're going to have to make for this program. The next alternative reduction actually relates directly to this rent. This would be to eliminate one FTE and relocate that funding to cover the rent and utility costs, which are about the same as a position that's an ISO 3. That position has been vacated since late last year, and it is in with the JRBG alternative program. All of those youth are currently getting the same services in JRBG and the Evening Report Center. So now that we have that state funding available, the kids are still getting the services. But again, if we had to move and we choose that location, this would be an alternative reduction that we could make in our current allocation. And then finally, another alternative reduction. As you know, we have entered into or selected a new vendor for medical services. And one of the options that we had them draw up for us is to outsource mental health. We currently have 3 senior social workers at juvenile detention facility, and they also serve juvenile residential facility, and none of them are filled, and we've had quite a hard time filling them. So there is an option within that package to outsource that, and if we did that, we could eliminate our 3 FTEs internally. If we do that, it's still a little bit higher for that medical contract at about $90,000, even with eliminating the 3 positions. So our decision package amounts to $105,000. Of course, the big unknown is the salary increases on the general fund side for staff after we implement our KDOC additional funding. And then our reductions could be $320,000, depending on your decisions on the move and outsourcing mental health.
Very good. I don't see any questions.
Wonderful.
You did a good job. Okay, Chris, I think you're on.
Good afternoon, Mr. Chairman, Commissioners. Thanks, Chris Labram, MABCD. On our workforce strength here, you can see that we're in pretty good shape. I'll talk about some turnover issues that we're having in the presentation, but this reflects how we sit operationally, so you will note that a lot of the positions on this chart do not show up as FTEs in our budget. Some of them show up as reimbursement to the City of Wichita. The middle column there, neighborhood inspection, that all of those are and always will be Wichita positions. The building and administrative services are county positions, but we still have several city employees within those. The neighborhood inspection areas there where we are missing a few folks Some of that is left over from COVID hiring freeze situations. Others is just reflected in basic turnover. Also pleased to report that on the building side, we actually made an offer for the position that is vacant there today. And then we're waiting for some things to stabilize in our financial, our service position over here on the admin side to get that rolling again. So again, we'll talk a little bit about turnover, but in general terms, we're in pretty good shape staffing-wise. So mission-wise, and we made an effort here to succinctly define what we do, but then capture some of the diversity in the department. So looking to obviously cultivate a safe, healthy, and a thriving community through full code compliance with all of our residential and commercial properties. Obviously want to do that with best practices and standards. That includes state and national level codes, and then the way we adapt those locally to ensure that all of our structures are planned, built, maintained properly. We want to maintain equity in all that we do there, and excellence in customer service, of course. So our goals break down to ensuring that our community buildings and homes are soundly constructed according to those national code standards. Our performance measures here include our code cycle, code adoption, our inspection frequency. Next, we obviously want to allocate resources properly towards those, as well as quality public services and being good stewards of our revenue and our funds. A lot of this, when you break that down further, reflects into the areas how we fund, since we're 100% revenue funded. So since we're using building permit and licensing dollars, but some of those go to fund activities that are outside of our department, and some of those activities within our department, but not directly related to the construction process. So we make sure that we coordinate well with our stakeholders to ensure that we are properly utilizing the funds that we receive from their revenue. Also, a lot going on between Public Works, planning, just in general with new programs. So one of our goals is to ensure that we properly support renewable energy, urban development, our development regulations and improvement projects. And we are seeing a lot of changes here. A lot of where we see this is in process improvement with us. So one example, solar regulations. We've done a lot to change and really streamline the permitting and licensing, or the permitting and inspection process with solar arrays, and we've seen about 3 to 4 time increase over the last 3 or 4 years in the amount of solar arrays that are being installed. We then seek to fully support Wichita neighborhood inspection programs, one of our major sections, and to fully support the Sedgwick County land use and environmental requirements and programs that we oversee. So into our challenges and opportunities, again, the turnover issue, and we mainly see this in our technical fields with our trades folks. So a lot of our employees will come to us since we are seeking qualifications. They'll often come to us after retiring in their first career. So while we love that experience and that's great to have, we then, of course, lose them, though, after another 8 to 10 years and are in that turnover zone. The other thing we see with younger employees, we provide a lot of qualifications and a lot of experience that then once they have that after 5, 10, maybe 15 years, they start to get some really good offers from the civilian industry. So we continue to seek adjustments and ways to offset that. We were successful last year, and it has been very well received that we now have a tiered staffing table on the inspection side, so inspectors can promote within their position as they gain qualifications. And we're seeking to apply that to our permit writing positions as well in the coming budget year. In addition to all of that, our plans examiners, so plan review staff as we often call them, they're our most qualified or have the most required qualifications of any of our positions. We have 7 total in that section. The supervisor retires this year, actually next month. Then we get a break in 23 and then have 3 reviewers actually retiring in 2024. So that is a scenario of concern for us to properly manage that. We do have permission at this time to overage a position to try to, a training position in place to try to soften that blow. Then similar to our code adoption, we try to run a 3-year cycle with hardware, software upgrades so that in any given year we're doing one or the other. Over the last few years, we've had server upgrades. We've also had some major software updates to our systems, and in the coming year, we plan to do a tech refresh, so we'll be buying new computer hardware for all of our inspectors as well as administrative staff. We also have some work on the table to revise the contract that we have and how we reimburse and pay the City of Wichita expenses that we have, looking to streamline that, simplify that, also get some rising costs that we're seeing there a little bit under control. We, of course, will work diligently to maintain our code adoption cycle and the work that our advisory boards do there. One challenge that we see is, of course, the highly increased activity in the areas of neighborhood inspection, nuisance, and dangerous building activity there. So we've got several asks in on the city side of the budget, the city general fund, to try to increase the amount of capability we have in those programs, and then trying to make sure that we properly account for that and the support of that on our side. And then something that you'll see as we get into decision packages is trying to get a little bit out in front of increasing issues we're seeing with blighting conditions in commercial properties as the commercial infrastructure gets older, and then we're seeing a lot more issues recently with vacant commercial buildings and the problems that those can often attract. We'll continue to work to establish our revenue fund and to manage our revenue. I still do have permit discounts in place. Building industry continues to grow. It's been very steady, so we have seen good growth. Last month was actually probably the biggest revenue month that I've seen since I've been here. So where we often have a lot of work to do with where we apply the revenue, we are in very good shape overall revenue-wise and continue to work to not increase that fund. Of course, industry activity, right now there are some concerns there, obviously based on the increase in material costs, issues with material shortages, issues with labor shortages. So we do worry about some of the potential effects that could have in the industry over the coming years, specifically if that was to result in a slowdown. So though we remain a little bit over our target in the revenue reserve fund, might be a good time to have a reserve in the coming years. Breakdown in our budget, just as others have stated, we had the extra pay period last year in personnel. The personnel shift also shows just moves in fund centers between some positions. That includes switches between City of Wichita to county employees, and then just some of the cleanup as we work with how we reimburse to the city. Then between contractuals and commodities, we've got some shifts there, again, just based on where we where we plan to spend money this year. So with the exception of the decision packages that we'll get to next, the budget, not much shift in our baseline or normal budget. Decision package 1 is a request to add 2 part-time inspector positions. So several of our neighboring jurisdictions have used this with very good success. We actually have a few of our retired inspectors working for neighboring jurisdictions as part-timers right now. We've discussed this with them, with the Builders Association, and would like to try to apply that best practice in our world. One of those specifically to help us deal with commercial blighting conditions, commercial case management, some of those areas that I brought up earlier, and then the other to help us with some of the very large commercial projects that we have going on right now, and just that overall increase in activity. So this request for both of those would come in total at $102,000 and change. It does equate to the equivalent of 1 FTE since it's 2 part-time. There would be So obviously, know that if we were not to put this in place, we would still be continuing to work through overtime. And the methods that we try to utilize right now. Do need to point out that this includes a one-time vehicle expense. 25,000 of that is calculated for that would be in the coming year only, would not be recurring. And then obviously the beauty of this too is that it gives us a very easy off-ramp if activity changes where we could do more of this or less of this depending on how well it is received and works. So second is based on increased need for customer service. Again, we continue to see increasing activity in the industry. We changed some of our processes that COVID was the catalyst for that. We've had very good luck with doing permits through appointments so that staff can give better customer service, being prepared for that. We also, though, with the way things are right now, we see a lot of complexity in projects, a lot more complexity in permits and in requests. So in talking with fellow agencies as well as talking with the Builders Association members, their suggestion was that the way they've solved those issues is with a full-time receptionist. So it was their suggestion that we attempt that and to support customer service with phone calls, with requests to help direct traffic for our permit writers, and then to perform transaction data entry, scheduling activities, et cetera, to serve as a support for them. So this is requesting 1 FTE to accomplish that. Totals reflected there. And that concludes the MABCD portion, if there are any questions.
Hey, you run a joint operation, so how much of this budget is Sedgwick County's and how much of it is Wichita's?
So the total we have here reflects the full Sedgwick County budget. On top of this, there is 1.1 million and a little bit that is city general fund. So this includes everything that we pay county for county operations, building operations. It includes just over $2.2 million that are put towards city neighborhood inspection. And then the city adds an additional 1.14 in general fund to that.
Okay, for example, on your decision package, this $102,000, they're only going to be working in the county?
So it would cover our entire jurisdiction, but that would be 100% county operation, county-owned equipment, and county employees.
Even though we're working in the city?
Correct.
Why do we not split this with the city?
Revenue fund, Chairman.
It's a revenue fund?
Yeah.
Yes, so we collect all the revenue under that as well. So yes, the city...
So it's not coming out of our general fund. It's coming out of the revenue that you're making.
That is absolutely correct. So yes.
Okay, good. And I like the fact that you're getting a vehicle. I was over in your parking lot the other day, and one of them looks like it ought to be declared a disaster area. So I think it's time that you do get a new pickup.
Yes, thank you, Chairman. We have a few that need to be replaced.
I was surprised you didn't have a placard on it. Very good. Commissioner Howell.
Chairman, just a quick question. Do you even offer these employees a chance to do mileage reimbursement versus having a vehicle? I mean, it might be better. It might be in their best interest to do mileage reimbursement.
Now, I take it, Commissioner, you're talking for the inspector positions?
Yeah, a privately owned vehicle, and then they would simply turn in their mileage. We would pay them for how many miles they drove for their job.
Since I have been here, we have not looked at that. The vehicles we use of course, have equipment that they use for their job. A lot of that's the computer stand. We also have a light package on the vehicle so that they are able to turn on special hazard lights in certain situations. Not saying it's not an option, but the answer to that is we have not recently looked at that.
Those are good reasons not to use a privately owned vehicle, but in cases where you don't need that type of equipment, there might be a way for us to not have to own a vehicle. And many times the employees actually like it because in their own mind, it may not cost them 55 cents a mile, but they can certainly charge us 55 cents a mile. And at the end of the day, we don't have the overhead to maintain that vehicle, and it simplifies things somewhat for us as well. So I'm open to the idea. In cases where it might work, I think we have to at least have that as an option. Thank you.
And especially with the part-time positions, that might be, we do utilize that with admin positions. So one thing that I did not note is that we are hiring 2 part-time positions, we're only asking for 1 vehicle, and that is because we have some underutilized vehicles we feel that can be shifted to cover that requirement.
Hey, just to give a counterpoint, I don't like using POVs. I think in our ComCare, we've got some liability issues out there where that we're running around at night in a POV. We've had an accident with MABCD with a government vehicle. I think we're hanging ourselves out there with a lot of liability issues when we start using private vehicles. Well, just a counterpoint. All right, Chris, I don't see any other questions. I appreciate it. So we'll turn it back to Rusty or the manager. Who's going to summarize this?
Okay, those are your 8 Public Safety Division departments. Just to keep it short, there's about a 3.01% increase. A lot of that is the AMS funds. The fund balance from EMS being transferred into the general fund makes up a significant portion of that. Otherwise, the budgets were generally flat or slightly down a bit because of the 27th pay period. And okay, where are we? Okay, maybe I won't summarize it. Technology got the better of me. Sorry. We'll get to the bottom. Okay. So decision packages, we had several. I think some of the other directors indicated that they had other decision packages that were previously sorted out. You got about $1 million worth of asks that came before you today. Shelley indicated the LODOX was a ARPA request, and she has an alternative solution. The LODOX would be a long-term solution to a problem that's just going to continue with the aging x-ray machine. We had 2 alternative reductions, and these were to offset other costs. These would not be savings to the county. These would offset other increases. Reducing the field service employee would offset the cost of increasing rent. That rent, by the way, is grant funded. Corrections pays that rent down at Harry Street out of a grant. But the additional cost, the additional $78,000 for utilities and increase in rent, they do not have grant dollars for, so that would be a general fund contribution. And in this case, she's offering to reduce a grant position, I believe it's a grant position, to make up the difference. And then being unable to fill those mental health worker positions down there, it would be eliminating the positions but using the money to pay for a third party to provide that service. So those are just offsets. And then Shelley's revenue package was simply a cleanup on the fee table that has no direct impact. So that's what's before you today. You'll hear others coming, other departments will come forward. There's a lot of competing interests. Obviously, compensation is our focus to ensure that our folks are being paid a competitive wage so that we can fill positions that are vacant. We can keep senior people here. We need to keep that experience here because a young workforce and an inexperienced and untrained workforce can be a liability or a difficulty in a lot of departments. So compensation is number one. At the same time, we do need to look for adjustments and enhancements in the way that we deliver services to our citizens. So that's what we're trying to do through this process. If you have any questions of me, I'll be happy to answer them. Otherwise, I'll move away.
Well, thank you, Rusty. And I do like this format. Not that I have anything against listening to Rusty. It's just that I like hearing from the staff that is very close to the questions. So I don't know if next year what you're going to do, but I did like this format today.
Very good.
Hey, Mr. Manager, we do have meeting tomorrow at 1:30 again with Admin Services. Do you have anything to summarize?
And I'll just do my budget tomorrow right at the beginning of that, so we can get you out of here on time today. And one other thing, back to Commissioner Cruz's question for, we're tracking anything that's a decision package that could be ARPA qualified. And Lorian will have a summary for you at the end of all the budget hearings, so you can take that into consideration if you choose to fund from ARPA. So you heard one of those today. You'll hear others as we continue to go through the meetings. So.
Very good. Well, I don't see any questions, believe it or not, and it's 4 o'clock, and we were supposed to be done at 4 o'clock.
There you go.
I want to thank the commissioners for staying attentive during this entire thing, and for the staff, and I do, again, like the format. So thank you all. We'll see everybody at 1:30 tomorrow.